Hi guys, Avi here from Hamilton Physio and Rehab and Precision Physiotherapy. Today I'm here to talk about back pain. Now, if you're having back pain, one of the most important thing for you to know is to understand what's actually causing that back pain. Now, back pain could come through a variety of different sources. However, it's super important to know what that actual source is because believe it or not, you will find that out after we do these tests that if a wrong treatment is attributed towards a wrong cause, then at times this pain could actually get worse and delay your healing. So what I'm going to do is, it's kind of tough because in an ideal case scenario, what happens is with a person suffering from a back pain, and they would come in and get evaluated by a clinical physiotherapist and find and do tons of different tests to find out the real cause of it. However, we're going to try and categorize and simplify things and see of how we can do this over a video. So first thing is, if at all you're experiencing a lot of pain with bending forward and prolonged sitting for a long period of time, and if you notice that the pain actually travels down the leg with being in this position, more often than not, this could be a disc problem. Now, when we say disc, it means vertebrae, that is bone and bone, and between the two bones there's usually a disc, and that's how our entire spinal column, or our spine or vertebral column is there. And these are sustained positions of constant lifting, pushing, bending, twisting maneuver could cause a little irritation on those discs and could cause pain going down the leg. So now this happens mostly in a younger group of population, that is 30 and younger, but often seen in a lot of a little older demographic as well. Now, the second cause is, which is the most common cause of all, which is stenosis. So, if at all any kind of extension maneuvers, or you don't even have to extend, actually, just standing position is actually kind of an extension maneuver of your spine, and these sustained position could, if it is causing a lot of back pain, or walking for a long period of time causes more back pain, then your problem could be stenosis. Stenosis basically means where the nerve roots comes out from the spine. Those canals starts narrowing down and then pushes a lot of pressure on your spine as well as some nerve roots there, causing a lot of problems. So disc problem and stenosis or arthritis problem is completely opposite to each other, because in disc problem you feel worse with prolonged sitting or bending movement, and you actually feel good when you walk around a block and then your pain disappears. That could be a disc thing. And with the stenosis, it's actually the opposite, where a lot of standing and walking could cause problem. And if you see people in the Target, or I shouldn't say Target, Costco or Walmart, and you find people leaning on to these carts, and these people are often trying to relieve a lot of pressure from their spine when they are dealing with arthritic problems. Now, the third and the most sneaky cause of it all is an SI joint problem. So, out of many tests that is done, one of those things that I often do. So, with SI joint problem, it's usually more, I've seen more females than male. However, common males as well. They would often point their pain exactly at this spot, so it's like not even back, just around where the hip meets the lower back, on just one side, more than that. So that's what you feel when I say SI joint. That means there is a sacrum, which is like a triangular, a wedge shaped bone meeting the pelvis, which is ilium, that is up here, just around that area. So when that two bones meet each other, that's called as an SI joint. And one of the tests that I often find positive is standing by the side and then asking them to lean onto one side, and then that causes either pain to the opposite side, or at times to the same side up there. That's a very sneaky one because it doesn't even shows up in x-rays and MRI. However, it actually comes in combination with other disc problems and the stenosis problems as well, and that's when it becomes a little tricky to direct what kind of treatment would help these people. So I hope you find this helpful. Give these a try and see. Let me know if any of that is positive for you, or you have more questions. Email me.